Then when we start talking about your mouth is killing you, your mouth is dangerous, your mouth could be putting you at risk, people are like, really? How does that happen? So doctors Bale and Doneen and Vigerust were the first to describe the pathophysiology of this so beautifully. And they call this the atherogenic triad of exactly how do these 5 high risk or dangerous bacteria have a direct and deadly impact on the artery wall, on that plaque, like we just saw previously. Well, 3 ways. Just briefly, we'll go into this more in depth in our more advanced courses. But remember, LDL is the bad cholesterol. So these bacterial pathogens and their endotoxins sort of call in the LDL cholesterol and increase the concentration of the amount of bad or these more dense, sticky, dangerous type of cholesterol at the site of the artery wall where plaque is residing. And then secondly, remember Laura talking about permeability of the endothelial lining. So this lining in the artery wall, the toxins have to get through that lining to get into the intima-media space where they live. And guess what? These bacterial pathogens, again, and their endotoxins, cytokines, other things, the inflammation that occurs there just opens up this endothelial lining and makes it much more permeable, or leaky, as we call it, for the bacteria, the toxins, the lipids, the debris, other items that we don't want in the artery wall to get into the artery wall, cause trouble, create a lesion, create a plaque, become a vulnerable plaque, and then it increases the stickiness as well. Once those toxins get in there, then these plaques become stickier, more like Velcro or glue, and it's more difficult for your body to clear it. That's at least 3 ways we know of that these bacterial pathogens have a direct contribution, a direct causal relationship with heart attack and stroke, because they're disrupting the smooth lining of the vascular wall and increasing plaque vulnerability. And then another study came out which actually described 5 ways that these oral bacterial pathogens get into the wall of the artery and into the arterial lining everywhere. We talk about heart because that's just my area of clinical experience and expertise is heart attack prevention, but vascular related dementia as well, because it's all a vascular disease problem. So these pathogens get into the brain and lead to not only vascular related dementia, but other dementia types, and then into our kidneys and cause renal artery problems, into every organ in the body, because it's really wreaking havoc, if you will, at the cellular levels. This all goes back to years ago when even the American Heart Association said, yeah, because there's so much evidence, we cannot ignore the fact that at least 50% of heart attacks are triggered by oral pathogens. So we have good data to support this. We just need to get the message out there, not only that it is well validated, we're practicing on evidence-based protocols, but that there is a way to treat it. There is a bright light at the end of the tunnel. We can all live free of heart attack and stroke.
We need to look at the 3 portals of entry coming from the mouth. The first one is what we just talked about, that like vascularity. So bleeding gums is what a lot of people associate that epithelial lining, and they're crossing over into the bloodstream, as we just saw. And then there is a direct penetration of the esophagus. As you're swallowing that long tube of our esophagus, it can actually penetrate through that. And then thirdly, we are swallowing. That is then these bacteria are then swallowed and make their way into our GI tract, and they are absorbed through the lining of the GI into that bloodstream. So you can see how it's impacted all ways. And Dr. Pritchard, you talk about this from tongue to tail. So tell us about our GI here as we move into that.
Yeah, so as you were saying, we swallow them and they cross this epithelial lining in the GI tract, much like we were talking about the endothelial lining in the artery wall. Well, before they get there, many of them in the GI tract cross this lining that is meant to protect us. And they also contribute to this dysbiosis, or this lack of health in the microbiome in the GI tract. So the next slide shows us a picture of this. So normally we have in this epithelial lining, we have a mucosal layer that's one layer of protection, and then we have this one cell layer thick of the epithelial cells with these little finger-like villi sticking up. And all of these things are designed, the cells, the villi, the mucosal tract is designed to move all of the toxins, the big particles like bacterial pathogens that reside in the mouth that we've swallowed, or any kind of toxins. Maybe it's pesticides in something we've eaten. Maybe it's red food dye in something that we've eaten. It could be a whole host of things, but these pathogens are supposed to go on downstream in the GI tract and be eliminated. They aren't supposed to make their way into the bloodstream, but because they cause damage to the GI tract, and because many other things we do in our lifestyle contributes to damage to the mucosal layer, the epithelial cells, and these villi, then it looks more like the right side of the slide, where the cells aren't nice and tight together, and there's wide open junctions and an inability for these gatekeeper cells to keep the toxins out and only allow the nutrients through. When it's working beautifully, only the nutrients get through. But most of us don't have a beautiful GI tract and a GI beautiful epithelial lining, and toxins are getting through. These bacterial pathogens are just one example of the toxins that are getting through. And as you know, based on the slides we saw earlier, when they get through the GI tract and directly into the vascular system, then that's where they can cause trouble in the vascular wall, in the heart, in the brain, in the kidneys. So on the left side, when we're swallowing these bacteria, getting into the GI tract, they get across the intestinal lining and they get into the vasculature and cause trouble in the wall of the artery. And we've just listed there that there are other things that contribute to inflammation. So even as these bacteria alone weren't disruptive to the GI tract, food sensitivities, allergies, autoimmunity, the fact that we're putting things down our throat all day long that maybe aren't the most ideal for our GI health, all of these toxins. Stress plays a role. And then the other thing I'd like to say is when we're not oxygenating well, then our mechanisms of eradicating toxins from our body are impaired. We need plenty of good, healthy oxygen going straight to the lungs so that when the blood supply that takes the oxygenated blood to every organ in our body, the GI tract, the liver, the pancreas, the heart, the brain, is well oxygenated. So if we've got an impairment there, again, airway to pathogens to plaque, we're trying to connect the dots between all three of these that are truly the worlds that connect us in dental and non-dental medical communities, and then the three concepts that we need to know in order to be able to save our own life and our patients' lives.